Hello audience, welcome to my video number 6 of my insomnia treatment series. And today we're going to be, or on this video, we're going to be talking about sleep medications and herbal supplements. My name is Valerie Williams. I am a nurse practitioner. I work as a sleep specialist in a sleep clinic in Southern California. Welcome. So I'm going to go over some prescribed medications or over-the-counter medications that people might be using that would interfere with your ability to sleep. So anything that's a stimulus needs to be avoided. I would say probably about 8 hours prior to your bedtime, if at all possible, because the stimulus will just increase the stimulus in your brain and also make you jittery sometimes, and those will not help your brain relax and fall into sleep if the stimulus is too high. Just like with anxiety and worrying, it will do the same thing to your brain. So I've listed here a few of the medications that people might be prescribed or use, and obviously diet supplements are not something that you need to be on while you're trying to improve your sleep, because they're very stimulating. They increase your metabolism, and that's how you kind of burn off the fat, and they're used that way to help people with losing weight. Also, a decongestant, one that's very popular on the market, is Sudafed. Sudafed has ephedrine in it, and ephedrine is actually a stimulus. Even though it works very well as a decongestant, because of the ephedrine, people can also have a stimulating effect from that. So we will tell people who have problems with nasal congestion to use a nasal saline rinse. You can get different types of nasal rinse either in the drugstore or online, and you just rinse your nasal passages and sinuses out with that, and that usually will flush out all the irritants or the allergic irritants that are in that nasal cavity that is causing the allergic reaction, just the swelling of the mucus mucosa there, so that you can't breathe. So using that instead will be less stimulating. Obviously, if you have, if you need to use a decongestant in the morning, that probably will be fine, but definitely not close to your bedtime, or probably within 8 hours. Excedrin is a very good medication for headaches, especially migraines, and it does contain caffeine, and caffeine causes vasoconstriction, which is sometimes very helpful for a person experiencing a vascular headache, where they have more blood flowing, so therefore they have more of a pounding pain in their head. So sometimes that works extremely well, but like I said, the caffeine is stimulating and needs to be avoided at least 8 hours prior to bedtime. Prednisone also is a steroid that can be stimulating, and also thyroid medication. So usually people will take that in the morning, so that's not usually a big problem, but I just want you to be aware it can be stimulating. And people with asthma or COPD sometimes will be using different inhalers. Usually it's mostly the rescue inhalers that people will find will be stimulating to their nervous system, and they'll actually feel a little jittery after they use it. Obviously, if you're in a situation where you can't breathe, you need to use your inhaler. Okay, but just be aware that it might cause you not to be able to sleep well because of the stimulant effect. Okay, so there are also antidepressants that are out there. Antidepressants actually give you chemicals that make you feel happy. They raise your mood. They increase your happiness and make you feel kind of copacetic and balanced. And they're very effective in treating depression, but some of them also can be stimulating because of this uplifting effect that they have on your disposition and your body and your brain. So obviously they're listed here. So venlafaxine and bupropion and duloxetine and fluoxetine, which another name is Prozac. Those are the ones that we will tell people that if you're taking these antidepressants, please continue to take them as prescribed. But if they're prescribed once a day, definitely let's have you take them in the morning. And if it's twice a day, then let's take the second dose maybe by 5 in the afternoon versus 9 o'clock at night. Believe it or not, blood pressure medications, especially your diuretics, hydrochlorothiazide and Lasix, they will, what they will do is cause you to be up all night. So even though you probably can fall asleep with them, you're going to be up using the bathroom, so that's going to interrupt your sleep. So we try to have our patients avoid using a dose at night before they go to bed. And if you have a second dose that's needed to be taken, then you need to take that also earlier, maybe by 5 in the afternoon. And then the beta blockers and the calcium channel blockers, these are blood pressure medications, and the beta blockers will always end in laugh out loud, LOL. So that's how you know it's a beta blocker. And then the calcium channel blockers will end in pine, PINE. Okay, so if you're taking these medications to control your blood pressure, just remember that they do depress melatonin production. So we encourage people take your morning dose, and then the evening dose, as with the other medications I just spoke of, take that second dose earlier than 9, maybe at 5 in the afternoon. Okay. So these are some of the most commonly prescribed sleep medications, and I just put these out here so people can understand the effects of these medications. So Zolpidem or Ambien has been around for a long time, and it does make you fall asleep very quickly, but usually it will wear off between 4 hours, and then your brain is awake again. It is a non-hypnotic benzodiazepine, so it's in the benzodiazepine family, and because of that, it can have a risk of tolerance and physical dependency. And some people have even reported to sleepwalk when they're under influence of Ambien. We used it quite a bit in the past, and probably in the last 2 years, the studies have shown that it can cause dementia and memory loss. And so we're trying to make sure people are not on this for a long period of time. And the FDA has given us some guidelines because of these risk factors now of how to prescribe it. So we try to stick within those guidelines to keep our patients safe. And because of the actual strength and suppression of the central nervous system or the brain functions, we want people to avoid any type of narcotic or alcohol with this medication. Okay, and definitely we do not give it for our patients over 65. And then your benzodiazepine, temazepam is Restoril, and lorazepam is Ativan. There's also Xanax is used often, and Klonopin. They're all in the benzodiazepine family, and you just have to be careful with these because these also are very strong medications. They kind of just knock your brain out, and because they can cause dependency, physical dependency, and increased tolerance, we try to only use these for short term and not for long-term chronic insomnia treatments. And because of the fact that they're depressant, then anybody with especially with breathing problems or obstructive sleep apnea, you definitely cannot mix this with any narcotics, or should you mix it with alcohol, because they're also, like I said, both depressants. And too much depressants in your brain at one time can keep your brain from waking up enough to be able to take another breath. So you got to be very careful with these medicines to keep our patients safe. There is a group of antidepressants medications that we use a lot for sleep. There's just 3 of them mentioned there: trazodone, nortriptyline, and doxepin. We use them usually in a very lower dose than what would be required to treat depression. And we found that in a lower dose, they're actually very sedating. And because your brain makes the chemicals that are in these medications, there's no risk of addiction or physical dependency. And actually, a person sometimes will report having better quality sleep with using these medications. So this is kind of our go-to in sleep medicine to use. I have probably about 8 of them in that classification that I've been successful treating and giving my patients if they need something for sleep until the behavioral changes also will help them sleep better. And sometimes my patients after time will not need the sleep medication because now their brain has been trained to sleep, and they have a routine that's helping their brain be pushed into sleep and stay asleep. So aromatherapies, I want to make sure people understand I'm all for them. We highly recommend them in sleep medicine. They have been proven to be very, very medicinal as far as creating a calm environment for your brain and soothing. So anything that decreases agitation or anxiety is definitely should be part of your sleep plan. And they come in different kind of scents, and lavender is probably the most common one, but there's also these others, rose and sage and chamomile. And now to let you know that they do come in different dispensing forms. Some will come in lotions, sprays, bath salts, and oils. Okay. Incorporating this as part of your sleep routine is really very helpful, especially that hour before your bedtime. People will do a lot of that. Okay. And then my last slide, we're going to talk about just some alternative therapies and supplements. So chamomile will come in a tablet form, or you can get it in a tea. Some people like the sleepy time tea. I know has that, the chamomile and also valerian root in it. And other herbs are lemon balm, passion flower, GABA, GABA, and then the kava and the valerian root are also very good, but they're not recommended for use if you have any poor liver functionings. Okay, so amino acids can also be helpful in helping the brain sleep. And also there's vitamins and minerals, vitamin B complexes and vitamin D and magnesium. Specifically magnesium glycinate is a supplement that is widely written about as being a very effective sleep aid. And usually the magnesium glycinate is something that we have found that most patients have to order online because it's not really readily available in most of the drugstores. And recommended dose is 200 to 400 milligrams, and you can take that an hour before your bedtime, and that helps to calm your nerves and decrease any kind of anxiety you have over maybe not sleeping or other things that are going on. Okay, so this concludes the video 6, and I hope that this information was interesting and helpful for you. And continue to follow me on my next video. I have 2 more videos left, and we're going to talk about sleep positioning and also other things that are helpful, how to get started, resources that we've gathered from my research and also from what my patients have told me that has been helpful in helping them sleep, and I want to share that with you. So until then, be safe. Sleep well and thrive.